A public health physician, Inse Abasi Kanem, joins me now to discuss this. Good to have you join us, Inse Abasi Kanem. Now, 9 months after, we continue to record deaths in alarming rates. Tell us why we're having this number of deaths and the factors that could be responsible for this.
Okay, thank you very much for having me. I would say that Nigeria has really learned its lesson from the 9 months of COVID-19. It's quite unfortunate that in 9 months we are still having deaths, we are still having numbers of new cases. Well, the truth is that to begin with, we did not start on time, in terms of disease surveillance, but along the line, we were able to pick up. But unfortunately, we have lost it again. And many Nigerians now are no longer interested in taking responsibility as far as COVID-19 is concerned. Many Nigerians are also not interested, in observing the precautionary measures. You move along the streets in Nigeria and you see almost everyone without a mask. You go to some stores, some restaurants now, and then you see people walking and out of the restaurant without a mask, without their hands sanitized. I think these are some of the reasons why most people, or rather why we are seeing the increase in the number of cases of COVID-19. I have personally been visited some hospitals in Nigeria, and then you see some people in the hospital without their mask, without hand sanitizer. So you see this refusal, to abide or to adhere to these precautionary measures is, causing the increase in the number. We were expecting that with the effort from NCDC and the Presidential Task Force, in educating Nigerians and in providing palliatives to assist Nigerians, to overcome this virus. That by now,
Dr. Kanem, just allow me to jump in here, because whilst we encourage people to abide by the guidelines, but Nigeria has about 1,111 deaths. But when you look at the countries that are responsible for more than half of this death rate, like the US, India, and Brazil, what factors do you think are responsible for this, especially with these three countries?
Well, I would say that, in Nigeria and other African countries, our antibodies is actually working for us. And that's why I really don't like to compare ourselves with other countries. When I'm talking about taking responsibility for Nigeria, we may not expect the number of deaths, besides the fact that NCDC has also tried. But I want to say that scientifically, there are some factors that have also accounted for the lower number of deaths in Africa. Most importantly is the presence of monoclonal antibodies among Africans. Science has revealed that is one of the reasons why the death in Africa is lower than compared to India, America, and of course the UK. But we should not leverage on that and begin to become less affair. We need to make sure that we still adhere to those precautionary measures, because it can happen to anyone. We still have people that die. We have almost tens of thousands of deaths, of infections. So we should not leverage on the fact that we have monoclonal antibodies, and because of that we become less concerned about COVID-19.
So because you keep saying corona antibodies, I want to understand what that means when you say we have corona antibodies in Africa.
Okay, now the thing is, if you look at what NCDC is doing currently, what we call the household seroprevalence survey for COVID-19. Now, it's in a way to let us understand the burden of the virus in Nigeria. But I would say this, that for those of us, for Africans particularly, that have been suffering from malaria, we have been exposed to some of the anti-malaria agents. Notably is the chloroquine. Now, when people take chloroquine, they are likely to develop what we call a monoclonal antibody. Their antibody is not an antibody for COVID-19, is for malaria, but it has, science has shown that same monoclonal antibodies has some effect on COVID-19, and that's why it's reducing the mortality, particularly of COVID-19 in Nigeria, and to an extent it's also reducing the rate of infection of COVID-19 in Nigeria. So that monoclonal antibody is what is responsible for the low number of death and infection that we have in Nigeria.
We hope that something is done about the complacency and nonchalance that you talk about. Public health physician Dr. Nsiabasi Kanem, thanks for talking to us.
Thank you very much.